This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
Weight and health go hand in hand, and that is why your weight matters. Go to www.yourweightmatters.org. Diabetes health. Regular visits to your eye care professional is a must to prevent problems that could lead to blindness. Hypertension health. A great way to lower your blood pressure and combat the corrosive effects of plaque buildup is to exercise. Arthritis pain. Don't just sit there, exercise. The best time to exercise is when the inflammation has already calmed down. Heart health. If you have a dog, think of the dog as an exercise machine with fur. A brisk walk is good for both of your hearts. Heart flutters. Your heart needs vitamins and minerals that aren't in our diet. Magnesium, calcium, iodine, and B-complex are 4 heart supplements.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that case is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
We're talking with the Obesity Action Coalition. We have with us Mr. James Zervios, Director of Communications, and Dr. Holly Lofton, who is on their board of directors. Welcome, James and Holly.
Thank you so much for having us. I appreciate it.
Thank you. Thank you for having me on.
We're glad to have both of you on our program today. We're going to get started with a few questions here. James, first of all, just what is the OAC, or Obesity Action Coalition?
Well, the Obesity Action Coalition is a national 501c3 registered nonprofit organization, and our goal is to help educate individuals affected by obesity and then advocate for access to care and treatment options for them, as well as eradicate weight bias and stigma associated with obesity.
Mm-hmm.
Okay.
Now you've been with the Obesity Action Coalition for more than 7 years, which is wonderful. I guess some of our listeners might want to know: did you personally have issues with obesity? Does it run in your family? What has made you gravitate to such a wonderful organization?
Well, yeah, it is correct. I've been with the OAC since the day we opened the door, and that was back in 2005, so about 7 years now. As a child, I was affected by obesity, and then about a year and a half, 2 years ago, I'm about 5'9", 5'9 and a half.
Mm-hmm.
I went to my doctor's office. I weighed about 225 pounds, and my doctor said that I was borderline hypertensive, going to have to go on high blood pressure medication if I didn't do something. And so that was kind of the first time in my life that my weight became an issue for me from a health standpoint. Happy to say about a year and a half later now, I'm down to about 160 pounds.
Yay!
Blood pressure is fine. Pulse rate is much better. I feel better, much more active. So it was for me, there's definitely a personal component when it comes to obesity, and it's a struggle. It's something that we definitely need access to care for. We need education. It's not a simple one-size-fits-all approach.
No, it isn't. It isn't. What measures other than weight can we use to determine if we're at risk for weight-related diseases?
That's an excellent question, Pat, and that does affect our community quite a bit as well as everyone worldwide, because you can look at one person and see their body shape, and they could have a medical problem. Another person may have what seems to be a heavier body type, they could be more muscular, have no medical problem. So what kind of measures can we use other than weight? That's a great question. One would be to look at your height versus your weight. And in medicine, we calculate an index called the body mass index, or BMI.
Yes.
And that's what James was referring to when he talked about his height and your weight, and you just did the same.
Right.
So we look at this number and we calculate things and we see where we are. So a BMI above 25 is considered overweight. If we're getting above 30, that's considered obese. It's even shown in studies that anyone whose BMI is above 22, which is actually normal by medical terms, does have an increased risk of cardiovascular disease. Their risk starts to go up. They may not have the disease, but their risk starts to go up even at 22.
Okay.
So that's one thing. The other would be your waist circumference. So you could have a person whose BMI is 25 and they're in a competitive weightlifting competition, and a person who has a BMI of 25 and they haven't exercised in 10 years. What they would look at, and you can do this in your home, you can do this at your doctor's office, get a regular measuring tape and put it around your waist. You want right above the top of your pelvis, above those measures, then we are at risk for weight-related diseases. So those are some things you can do at home. And we have a BMI calculator on the Obesity Action Coalition website to find out what your BMI is. I think everyone should know your BMI just like you know your phone number, your waist circumference.
Absolutely. That sounds great. You know, I as an African American, I have a great deal of obesity in my family, and I think it is prevalent among African Americans, but it tends to be the poor working class also have obesity problems, and our children have obesity problems. Is this still in epidemic proportions in the African American community, or has it leveled out or still increasing? And what about our children?
Actually, the level of obesity in the United States has come to a plateau recently. The 2010 data just came out from the Centers for Disease Control in Atlanta, which is my hometown, and we actually seem to be making some leeway in preventing the level of obesity in Americans overall from increasing. So we've leveled out about 35% for adults. We leveled out in children. However, we are still seeing an increase in obesity in adolescent and teen boys. So we have some work to do there.
Oh, really?
But it's getting better. And I also see obesity quite in my family. And we all struggle with this daily. Just like
Oh, yeah.
we have it at some point in our lives. We're either at risk or dealing with obesity.
There you go.
So I think this is not anything that should be ignored by any American. We all need to make sure that we're doing our exercise and watching what we eat, because it will affect us either personally or someone that we love.
Yeah, you're absolutely right.
Dr. Lofton, what actually is the reason for these ethnic differences in obesity rates?
Yes. There are some studies that looked into that. You know, number one, of course, there are genetic differences in African Americans, people of African descent, people of Caribbean descent that are not going to appear in Hispanics or non-Hispanic white population. So that's a difference in how we process fats and calories, where we carry our adipose tissue. However, those genes have been around since the beginning of time, and we can't change them. So we really need to focus on what we can do for ourselves. The studies have shown that African Americans are less likely to be as physically active as recommended. And right now, what is recommended in the United States is 60 to 90 minutes of physical activity
Right.
most days of the week. So that'll be 4 days a week. So we're less likely to make that goal. Another thing to be, as you mentioned earlier, Pat, would be that in the lower socioeconomic classes, there tend to be what we call food deserts. Now, food deserts are areas where we have limited access to fresh fruits and vegetables, and people have less money to spend on healthful, nutritious
Right.
food. And the food retailers don't really have the financial incentive to go out to these areas and place these healthy, convenient foods there. So the people who live in these food deserts, and that's really defined as you're more than a mile away in an urban area
Right.
from a grocery store that carries healthy food. If you live in this area, you're at risk just because of your environment.
Yeah.
The other thing could be insurance. Do we have access to providers, doctors, nutritionists, for people who have more extreme obesity? So obesity doesn't need to be treated in the doctor's office, or overweight doesn't necessarily need to be treated in the doctor's office, but for those who are at the higher BMIs and they need to have an option such as surgery or such as a behavioral intervention that's very time and labor intensive, if you are don't have access to health care because you're lacking insurance, 20% of African Americans don't have health insurance, the white population.
Yeah, that's
So
true.
that's another thing that can be limiting, and why these differences are seen among the ethnicities in America.
Yeah. You know, one of the things I'm going to veer off a little bit because you mentioned something about underserved, and it's African Americans as well as underserved, and it seems really kind of unfair in a country as rich as we are, that fruits and vegetables and the things that make us healthy sometimes can be more expensive than, a McDonald's for dinner, that kind of thing. But I think it's also, how can obese people, and I'm going to include myself in that category, because even though I'm not obese anymore, I still think obese. You know what I'm saying? You know what I'm saying, James, right?
Yeah.
Yeah. How can we recondition ourselves? Something practical that we can recondition ourselves, that if we're overweight, little things that we might be able to do to just gradually cut back and make that BMI more acceptable.
Well, Pat, I would say the number one thing would be to try to increase our physical activity. You don't have to think of it as exercise. You don't have to join a gym. You don't have to get equipment. You can get off the bus one stop earlier and walk. Start making it 2 stops and then 3 stops, and overall you're increasing your activity. The recommendation I mentioned before is 60 to 90 minutes for an adult in the United States. It does not have to be an hour all at one time.
Yes.
If you have 10 minutes in the morning, 10 minutes while you're at work, 10 minutes after work, and then you can do 30 minutes later on, that will be fine.
I have some obese friends that say, well, I walk all the time at work. I don't need to go home and walk or get up in the morning and walk. I walk plenty at work. What's wrong with this picture?
Well, the calories that they're consuming are too much for the amount of walking that they're doing. So they need to either walk more or really cut their calories. So what you can do is, one way is log what you're eating. You say, okay, let me write down I'm eating, it's 2,000 calories. I'm only walking off 200 in a day.
Good idea.
So that's going to cause weight gain.
That's a good idea. Yeah.
So we need to do more than what you're already doing.
Yeah. Yeah.
And this is a question for James. We do want the public to get involved, but what resources does the OAC have available for the general public?
Well, we have a wide variety of educational articles hosted on our website, many of them written by Dr. Lofton. And the articles, they really run the gamut as far as the issue of weight. There's even articles on there about childhood obesity as well, and then weight bias. So it really depends on where you find yourself along that line in addressing your weight. For someone that maybe feels that they've tried medically managed weight loss, they've tried commercial programs, they've tried to do it on their own, are they considering something like weight loss surgery? If that's the case, we have resources to read up more on that yourself. And then on the other end of the spectrum, if somebody says, well, you know what, I'm thinking about giving commercial weight loss plans a try, we also have information on that as well. So to really help you become an informed individual so that you make a choice that you're comfortable with.
I agree with that. I have the fat obesity. Since I've been obese, I have that type of mentality, so I'm always working and struggling. And on the other side, and I'm going to get into this because he's laughing at me, he has never had a weight problem. He's about the same weight as he was in college, and that's 30 years ago, whatever. And my thing is that I think it's more than just eating. It has to do with emotions. It has to do with stress. His opinion is this: just stop eating. And I say to him, it's not that simple. You see a person and you say, they just need to stop eating. And I'm saying it's more complex than that. How would either one of you address that?
Well, if I can start, James, I do think that life events trigger not only stress, but changes in patterns. So some of the typical life events that I see affect people's weight in my practice would be a new relationship, moving,
Yeah.
having children. There are hormonal
Yeah.
things that go on when you have children that makes the spectrum completely shift to you're having more fat tissue than if you're an adolescent girl. So as far as other people's patterns, so if you're in a new relationship, it's great. You want to go to dinner all the time. You may stay in more and do a little cuddling. You exercise less because you want to wait for your partner to get home. Things like this.
Yeah.
Later. So those things, when they add up over time, those life events can change in a way that make you more prone to gaining weight.
Yeah. That makes a lot of sense. Okay.
I think that, and Holly summed it up, Dr. Lofton summed it up very well there with what she just said. And, one of the things that we've come across here at the OAC is that we've actually worked with individuals that were abused as a child. They might have been molested by a family member or a friend of the family or something, and they felt that if they put the weight on, that nobody would ever want to touch them again. And I've actually dealt with it. Most of the time it's women. In fact, it's always been women that I've seen this in. And it's interesting because that's something that cannot be solved by just, pushing back from the tip. It's very much a deep-seated emotional there that needs to be addressed. probably with a psychologist, in order to start addressing that weight gain there and help them kind of work through those issues. So there's a lot more to it than just pushing back from the table.
Thank you. I'm glad we've got some experts to validate that. Now, I'm just so excited about this conversation because it's so important in our community and for us personally. What can we as individuals and as a community, in an African American community, do to combat obesity, overweight problems? What can we do as a community, as a churches, or what have you? What do you think?
I think the African American community has a great realm of platforms through which we can address this problem.
Right.
One, as you mentioned, will be the church. The Black church is a strong part of the community for which we can make a lot of change.
Absolutely.
Having church walks, things that are in neighborhoods such as Boys and Girls Clubs for children, dancing classes for children, Biggest Loser contest. People have a competitive edge.
Yeah, okay.
And when you really tap into that, you can get a lot of good results. I've seen it at my family's own church in Atlanta that does do well. Nutrition and wellness workshops and health fairs within the job place can really push people to make those changes and know that they don't need to be ashamed. That's one thing that we really at the OAC try to improve and get rid of the obesity stigma that exists. I do believe that one reason the obesity rate is leveled off is because we see it now more as disease, hopefully, and less as a social flaw.
Right.
That's not what it is at all. As far as individuals, I would say know what your ideal weight is. Go online, go to obesityaction.org, find out what your BMI is, measure your waist circumference, get your doctor to do it, and then sit down with your family, your mothers, grandmothers, and say, what diseases am I at risk for? Because these things they need to have early screening for. We need to exercise, and 4 days a week is what we recommend. But don't worry about trying to do that. Start off with 1. Going from 0 to 1 is better than staying at 0.
Amen. That's the truth. It takes step by step, and it's like the Alcoholics 12 Recovery. You have to do it a day at a time, sometimes a meal at a time, and you have to have that incentive, that desire, and something has to spark your self-esteem to say, I want to be healthier, because I know as a obese mentality that we tend to procrastinate and not stick to it. That's one of the big problems.
Right. And you don't have to abandon your favorite foods. I know we don't eat soul food every day, but we love soul food.
Yeah.
Cheese.
Yeah.
And other things.
Yeah.
You don't have to abandon those because you have a health problem, because you have a weight problem that you're addressing. There are lots of alternative recipes that you can use and still enjoy your favorite foods while reducing the fat, reducing the calories. There are such recipes on nutrition.gov, several recipe books out there for getting our favorite foods and having them in a low-calorie version. So you don't have to think of it as I need to lose weight, as I need to deprive myself. That's the wrong attitude to have, and it won't lead to a long-standing lifestyle change, which is really the goal.
That's true. It's a lifestyle. It's eating for life and not eating for a diet. I think the word diet, it just kind of throws people off too.
Yeah, it's temporary.
James, we think the OAC is so very important and it's needed. And just tell us, how can the listeners get involved with the OAC?
Well, and I just want to speak to Dr. Lofton's point for a quick moment.
Sure.
Where one of the biggest issues with fighting this epidemic of obesity is that most Americans do not even realize that they are affected by excess weight. And one of the best ways to get involved with the OAC, well, first and foremost would be to become a member of the OAC. As a member of the OAC, it's $20 annually.
Okay.
You'll receive the Your Weight Matters magazine. It's an excellent magazine, a lot of educational topics in there, and you'll also be supporting the cause. In addition to that, the OAC has a free public awareness campaign to raise the awareness of excess weight in the U.S., and it's located at yourweightmatters.org. That's yourweightmatters.org. And you can go on there, you can learn more about excess weight, you can do your BMI, and on there we have a challenge. And the focus of the challenge is to download this toolkit that will help you prepare for your first visit with the healthcare professional to discuss your weight. So the challenge is absolutely free. ObesityAction.org is where you can go to join the OAC to get the magazine, and YourWeightMatters.org is a campaign that we've set up to help raise awareness of obesity in the U.S. So really those are two excellent ways that you can become more involved with the OAC and get something out of it in the end.
I think that is excellent. And this year, for our listeners, we're going to be running tips on the Obesity Action Coalition. We're going to get maybe 3, 4, 5 ingredient recipes that we can text to our people. James and I are working on a lot of little ideas. I'm hoping that we can get together in a couple of weeks and just throw out some ways that we can get this out. And I'm just so excited to have the Obesity Action Coalition as a part of our partnership, joining so many other well-renowned organizations, and we're really excited about it. Now, do either of you have some parting words before we sign off?
Let me go first, James. Again, I apologize for taking over a little bit. I want to thank you all for bringing this to the forefront, especially about an African-American community. I want to reemphasize we don't have to deprive ourselves in order to lose weight and to be healthier. Please eat breakfast. I say within 1 hour waking up is the most important thing you can do to get your metabolism on track to lose weight and to be healthier. And don't feel that you have to shy away from telling your family members, co-workers, that you might be with people. Be very supportive and on your side, and they get some tips for you as well.
That's true.
So, just take control of your health, and I wish everyone the best. Thanks.
Thank you.
Did you know that African Americans have one of the highest rates of asthma? Asthma is a lung disease that makes breathing difficult for both young and old. Although there's no cure for asthma, it can be managed and treated so you or your loved ones can live a normal, healthy life. You can be as active as you want to be. The American Lung Association can help. Learn more about asthma and keep it under control by visiting www.lungusa.org or call us at 1-800-LUNG-USA.
We want to thank our sponsors, Dendreon, American Medical Systems, Sanofi Aventis, Genentech, and C.R. Bard.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyber Station USA.